Today's topic on Keith RN, how to thrive, not merely survive, nursing education. Your goal as a student is not just merely to get through or just to get by, but is to truly thrive and maximize your learning so that you can be the best nurse that you can possibly be. Today I'm going to be talking about important principles as well as content that you must know deeply that will help you make this a reality for you and your experience as a nursing student. First topic, have realistic expectations regarding your performance and your grades. I have observed as a whole that nursing students are driven, perfectionistic, and used to getting A's in high school or in college. But in order to successfully transition and thrive in nursing education, you must remember this. You're not in high school anymore. You're not in a less difficult major, but you are in a very difficult program within nursing. It's typically the most difficult major on most campuses, and you just can't attend and expect to pass. It requires at least 20 hours of studying a week in order to be successful. Even if you are an A student or valedictorian of your class, you may struggle to maintain that A within nursing. Accept this reality as the new normal. So what it's all about is learning and using that knowledge at the bedside. That is your goal as a nursing student. Desire and apply yourself to be the best nurse that you can possibly be. This is what matters most. So step back, take a deep breath, and remind yourself that a letter grade does not define your value and worth as a human being. Nor is it even a predicator of whether you will be successful as a nurse in practice. I believe that your true identity, value, and worth is not defined by how well you perform, but that you are loved by a God who created you. And that gives your life meaning and purpose regardless of your grade. Second topic, take care of yourself. You're going to feel like a gerbil on the wheel, constantly spinning, run, 168 hours a week, and every moment seems to be full. The bottom line is this, do not let nursing education become your life. Though it's important, you have relationships around you, of family, of spouses, etc. Don't let the tyranny of the urgent, which is simply this, allowing the urgent things of life, keep you from doing what is most important, like taking care of yourself. The perpetual gerbil wheel you will feel while you're in nursing school will be incessant, and you will feel those demands. You need to renew your tank. Nurture your spiritual life. Give your life margin. Those blank spaces on a page that have no purpose in a book, but they provide a boundary and a balance to the page. Your life needs margin, and you need to seek it out and to make time for it. So look at just those strategies that you can do to nurture yourself and your spirit. You know, I'm not your mother, but get plenty of rest, eat healthy, participate in outside interests, and do what is most important in life. And that's oftentimes things like the spiritual needs that we have, that we often neglect. Nurture your spirituality as well as engage in physical activity. That actually, things called endorphins, make you happy and can kind of, can combat the joy-stealing environment that academia can sometimes be. So now let's look at 3 topics that you must know well. And they're all science related as it relates to having a deep learning of what's most important. I like to use the iceberg metaphor. In nursing education, there is TMI. TMI, too much information. We have a skin-deep, broad knowledge that you get and are expected to learn, but many of you do not get the deep learning of what is most important. And so what I want you to recognize is this. Make it a priority to pursue and spend time on what's most important. I'm going to share you 3 things that are important. Number 1, anatomy and physiology, A and P. You need to know this well. You need to know the disease processes of your patient. Why does your patient have the symptomology that they have? For example, if your patient now is diagnosed with heart failure and they were admitted with increasing shortness of breath, orthopnea, weight gain of several pounds, pitting edema, and you collect your vital signs that show the tachypnea, low sats, crackles in the bases, pitting edema in the lower extremities, can you tell me, based on your knowledge of physiology, is this right-sided failure? Is it left-sided failure? Or is it biventricular failure, and why? When you as the nurse know your physiology for every illness that your patient presents with, and if you don't know it, look it up on a great reference. My favorite web-based resource is emedicine.com. You can learn and have that critical thinking, because when the nurse knows their pathophysiology, when you know that the symptoms I just described are biventricular heart failure, you will be one step ahead in being able to anticipate what is expected and what is unexpected in that presentation. So you must know your A and P. Second science you must know well is pharmacology. As it relates to pharmacology, the most important aspect is, yes, to know your dosage range, know what's your, how your the 5 to 7 rights of med administration. But what I want you to focus on with the science of pharmacology is understanding and able to state in your own words the mechanism of action. And this can be found in any drug manual, nursing like Davis Drug, or when you go to micromedics in that context, it's going to give you the physiology. That's why in order to understand the pharmacology mechanism of action, you as a nurse must be able to situate your pathophysiology to pharmacology. So for example, if you're going to be passing a beta blocker of atenolol, 50 milligrams, is your instructor like me? And will she ask you, what is a beta blocker blocking? We know the classification, and most students can say, yes, atenolol is a beta blocker, but if you as a student are unable to tell me in your own words what a beta blocker is blocking, you will not have the deep level of what is most important and transfer that to clinical practice. Now, beta blocker is simply, as you know, blocking the beta sympathetic nervous system receptors on the heart, which is therefore then going to lower heart rate and lower blood pressure. Did you catch something of the relationship? When you know the physiology, you know what the most common side effects and the assessments that are required by the professional nurse. You don't need a drug book to tell you. So when you know that a beta blocker is blocking beta 1, lowers heart rate, lowers blood pressure, you're going to assess heart rate and blood pressure before you administer it, and may have to follow it afterwards to see what their response was. So make pharmacology and the mechanism of action a priority, and to deeply understand this in clinical practice. Third topic to understand deeply is fluids and electrolytes. Now, fluid and electrolytes is much more than just being able to memorize by rote the hypos and the hypers of sodium, potassium, calcium, chloride, etc. That will not prepare you for professional practice. You must be able to apply fluid and electrolytes to the bedside. For example, the lab values. When you have a patient, for example, who now has renal failure due to heart failure, and because that patient is volume overload, their sodium is going to be low, sometimes in the low 130s. Why? Well, if we understand that sodium is the Kool-Aid electrolyte, which simply means that if I take a packet of Kool-Aid and I put it in 2 liters of volume, it's going to get just right. But if I put that same amount of Kool-Aid in 2.5 quarts or 3 quarts, it's going to be dilute. and be dilutional. And in volume overload, it's the same thing. So that's why understanding the whys of fluid and electrolytes. Why are they hyponatremic? Why do they have elevated creatinine? Why is the potassium elevated in acute renal failure that's often caused by heart failure? And understanding the relationship between perfusion and the lack of ability to filtrate at the tubule level, the potassium, and then what are the symptoms of hyperkalemia? Applied fluid and electrolytes is much difficult. It requires clinical experience. But I want you as a student to ask one question like a 2-year-old. Why? Why would your sodium be this in this context of this illness? And when you can answer the why, you will be well prepared for professional practice. So as we look at these questions, I hope that you found these topics and just my brief explanations helpful to you. And I want you to know that my heart and my passion as a nurse in practice, as well as a newer nurse educator, is to see new students and new nurses transition successfully to real-world practice. And it's been my experience that a lot of things in nursing education are currently a work in progress. And sometimes we have TMI that prevents us from obtaining the deep learning of what's most important. We don't utilize the clinical reasoning of how a nurse actually thinks in practice as highlights of our program. It's a work in progress, and some programs are doing very well, but many are still struggling. But I've written a book called Think Like a Nurse, Practical Preparation for Professional Practice. The second edition will be coming out in September, and it is going to be a peer-reviewed volume of other educators and clinical experts, and it is going to be a resource that will help put an exclamation point to what is most important of the content that you are learning, and hopefully learning well, so that when you are on your own and there's no clinical educator overlooking you, you will be safe and well prepared for professional practice. So be sure to check out the link on this video as well as in the YouTube section, and look forward to any thoughts or comments you may have. And I currently have some pre-purchase discounts available until it's published mid-September. So thank you so much, and blessings to you in your journey to become a professional nurse.